healthcare system is broken, but it doesn't have to be. This is Revenue Cycle Optimized by Infinix Healthcare. We discuss the latest challenges in the revenue cycle space and provide actionable tips on how to overcome them at your organization.
Welcome, everyone, and thank you for joining today's Office Hours. Today's session is titled The $50 Billion Rural Health Question. That title's a mouthful, more ways than one. So I'm joined today by Scott Cook, who's our VP of Business Development here at Infinix. Scott, thanks for joining me today. How are you doing?
Doing great, Stuart, and happy to talk about this very important topic that we're talking across the country right now.
Yeah. I think it's caused a spur of confusion, so to speak. And what that is, we're going to talk about the Rural Health Transformation Program. That's where we get the $50 billion part of the title. So the attention is always around this $50 billion funding opportunity. And that's a lot of money. So when people see that, everybody's eyebrows raise. But what does it really mean? And what rural healthcare leaders should be thinking about beyond that headline number, so to speak? Because as we all know in healthcare, anytime someone says there's a funding available, the next sentence usually is, here are 900 things you need to do before you can maybe access it, right? So today we want to kind of break that down, unpack what this program is, what it's not, and what it may mean for rural hospitals, clinics, and even health systems trying to balance access, workforce shortages, technology needs, as well as revenue cycle pressures and long-term sustainability. So with that, Scott, you ready to get started?
Let's do it, Stu.
All right, we'll dive right in. So the first question, pretty obvious question, when people hear, 50 billion for rural health, that immediately sounds like a big deal. And it certainly is. But what do healthcare leaders need to understand about what this program actually is?
Yeah, Stuart, I think this is kind of key to the whole conversation. And I think you hit it on the head earlier when you're talking about what spending most of my career in rural healthcare is the unfunded mandate work that we all get assigned. And this is a little bit opposite of that. But the first thing people need to understand is that this is being framed publicly as sort of a rescue package for rural healthcare. But operationally, that is not entirely what it is at all. So this is not a direct replacement for what we've seen from broader Medicaid funding pressures that are happening through the One Big Beautiful Bill, OBA, and other CMS policy shifts. And really what it is a temporary transformation pool designed to help states experiment with new delivery models around telehealth, behavioral health, workforce development, and care design. And that's very different from stabilizing the underlying economics of rural healthcare. Just to give context, because right now most rural hospitals are underwater financially. That's been the narrative for more than a decade. But depending on the market, Medicaid only reimburses hospitals about 85 to 90 cents for every dollar they actually spend on delivering care. And some places much lower than that. So let's put this all in context. You have a 22-bed rural hospital that's already losing money on Medicaid patients, struggling with staffing shortages, watching inpatient volumes decline across the country. And that hospital may receive funding to launch telehealth or behavioral health initiatives, but leadership still may be asking, can we afford to keep OB open? And what you're seeing is this may help redesign care delivery, but it doesn't fix the underlying causes that we have in rural healthcare reimbursement.
Nice. Yeah. So as a follow-up question to that, what do you think this program is really designed to solve? You've explained what it is, but hey, what's the point, right?
Yeah, and I think that's what everyone's asking as well. What's the underlying pressures? And I think key to this is that I truly believe CMS understands that traditional rural healthcare model and the way we're reimbursed currently is under severe pressure financially and probably not sustainable. I mean, there have been over 140 rural hospitals closed nationwide since 2010, and I think they just came out and said there's another 400 at risk, even before OBA and everything else. Entire counties have lost OB access, and all these behavioral health shortages have made. So they're very aware of what's happening. Now, the goal of the program, I think, is to push rural healthcare towards a more outpatient care, virtual care, and try to find funding and operational benefits for behavioral health, which has always been a struggle. And then also drive regional collaboration and value-based structures. Because right now, the current value-based market does not really benefit at all rural healthcare, and it's mainly designed for metro areas. So on top of this transformation funding is really being introduced into the system as an already unstable financial problem. And they can launch these innovative behavioral health firms that still struggle financially. But overall, I think it's trying to develop new systems to kind of think out of the box at a local level and see what sticks over the next 5 years based off of funding.
Right, right. And when we were talking about this, you made an interesting point, and that was the $50 billion number gets a lot of attention, but that doesn't necessarily mean rural healthcare is suddenly flush with new money. So how should rural providers think about the bigger financial picture around this program?
Yeah, and I think what we talked about is with OVA coming in the next year or so, studs have been implemented. The numbers I always try to converse with people, especially in mobile healthcare, when they see that 50 billion, is they're cutting out 900 billion out of Medicaid over the next 10 years. So even if you did simple math, that's 75 billion a year, and only get 50 billion over 5 years. And that's split up 50-50 between CMS requirements and based off your rural population. So this is a really important part of the conversation. And I think rural providers cannot look at this program in isolation. As they're discussing transformation at CMS for funding, we've already talked about all these pressures from labor to denials, complexity. It's really looking at the same thing. And what we need to do from looking at this not necessarily as a new funding source, it needs to be looked at as how can we try out some operational things that we've probably been too fearful for to implement and see if we can make it work logistically and operationally for sustainability. That's really the goal. This shouldn't be looked at as a rip and replace funding source. It should be looked at, hey, do you have a telehealth and you thought of the idea? Well, here's a little bit of funding for that. If you have some workforce shortages, how do you develop local resources, develop staffing and development of your local talent? I think that's where this is really looking at, especially when we talk about transforming operating revenue at the same time.
Sure, sure. Yeah. So it sounds like taking money away and then adding money back in. The perception is it's not, yes, new money. It's almost like a shifting of funds in a way, maybe reallocating those funds in a way. And so, to your point, looking at the big picture is, so impactful, so important to have those considerations. It's not like, oh, we're going to get new funds, we can finally do some things. No, they're actually taking some funds away as well, or may have already taken some funds away as they notice, and they're just repurposing it, sounds like. So one other thing that stood out to me is that this program is not necessarily going to look the same everywhere. Each state may have its own process, priorities, and approaches. As we know, each state has its own regulatory requirements. So, with that, why does that state by state variability matter so much for rural health hospitals and even clinics and health systems?
Yeah, Stuart, I think this is probably one of the more innovative attempts at this, that trying to apply federalism to healthcare and say, hey, we're going to give this essentially 50 different versions of the program. This is not a national payer funding source. It is all going through state allocations that each state will apply for. But that also adds to the chaos. As I've traveled around the country, you hear everybody talking about what is your state doing versus my state. And it limits a little bit of the ability to talk to your peers across the country. And you're more reliant on the people inside your state from that standpoint. So it effectively makes a very interesting dynamic. But the other thing I would say kind of draw concern from this is that some states already have a very mature infrastructure and strong rural healthcare offices, existing provider partnerships, and managed care programs. Other states struggle with administrative complexity across each one of those things. So you're going to get a wide variety how they implement it. And essentially two identical rural hospitals in different states may have completely different outcomes, which I think is, again, part of the experiment with this funding that unfortunately, like you talked about, has financial pressures to it, but it has razor thin opportunity. But they were trying to really capitalize to see who kind of comes up with the best idea. It's essentially America's Got Talent in healthcare. And I know that's not necessarily the comparison we want to make.
Right, exactly. Exactly. And a lot of that, the disparity between states has a lot to do with leadership. And I'm not just talking about state level, Senate, the congressional leadership, whatever, or governor. I'm really talking about leaders in the industry, healthcare administrators, practice managers, RCM directors, CEOs, CFOs. You kind of see that disparity where they almost have to roll up their sleeves and get involved and do it themselves. And so you can see where there's strong leadership in that respect. The states kind of have it put together as well. But the one with the disparity that you just described, at least that's been kind of my observation from that. So let's talk about the application process and administrative burden. So it's one thing to say, hey, I'm going to get this revenue, I have all these ideas about it, but it's another thing to actually go through the process of getting it. And we always know it's like, is the lemon worth the squeeze, so to speak, or the juice worth the squeeze? So a lot of rural healthcare teams are already stretched thin. They may not have, large grant writing teams, policy teams, or extra administrative capacity sitting around waiting for one more project. So how difficult could it be for smaller rural organizations to apply for, track, and report on this funding?
Well, Stuart, potentially very difficult, unfortunately, as we talked about, kind of that unfunded mandate. And if you're a rural hospital with a grant writer, cherish that person, pay them what they need to do, because that is worth their weight in gold. That is such a vital resource. But I would say another issue that we see with this transformation program is the organizations in most need of the support are often the ones least equipped to deal with it administratively to access it. And trying to find those resources and expertise in your local locality is very difficult. I mean, you kind of hit the nail on the head. If you're already a rural hospital where you're a CFO, they're overseeing HR, IT, it's potentially outsourced. There's no grant department. And now not only are managing, we're coming on June, year-end budget, plus cost report, plus board meeting, where are you finding the time to essentially apply for a grant? And then on top of that, layer on the reporting requirements once we already have that. So whether that be workforce documentation or quality metrics, there's a multitude of layers to make sure you keep sustaining that funding throughout the process, and then also trying to optimize it to make it budget friendly after the funding might go away after 5 years. So extremely difficult. And I would even say it's out of the weeds for larger health systems. I think they face the same problems from that standpoint, and they do get some of these funds based on the rural population. They might have some dedicated grant infrastructure, but at the end of the day, we're still trying to essentially figure out if we have the resources to fit the grant. Does it make sense for us to apply for that area of the grant that you're getting? And how does that work out in reality? I think there's a lot of great ideas, but when it comes down to brass tack, it's a lot of administrative work and a lot of follow through to make sure it actually becomes sustainable. So it's going to be difficult, but I think it's worth the time, obviously. A lot of good people are doing a lot of hard work in a very difficult system.
Yeah, and this program appears to be focused on sustainability, which is what we're trying. It's almost counterintuitive to what you just said, and it's trying to produce that, but which sounds great in theory, but sustainability can mean a lot of different things. Like when you think about rural health transformation, what are the areas where this funding could have the biggest operational impact? Is it telehealth, behavioral health, workforce, some type of technology, the buzz around AI and automation? Is it revenue cycle? Or maybe it's something else.
Well, I would tell you the first thing, Stuart, is it's already capped. So I think it's 10 and 15% can only be allocated toward either structural improvements to your facility or to provider payments. So we already know that's limited back here. But I would say the other portion that remains probably the foundation is workforce development. I think that's where money probably needs to be put forward the most. If you can find something sustainable in behavioral health and telehealth based off your recap locale, I think that's perfect. But I've been quoting this lately. It is death, taxes, and workforce shortages. That's what we're dealing with in healthcare. And that will be for the remainder of the time that I can foresee. So providers can invest in this technology and telehealth care redesign. But if they can't recruit clinicians, coders, nurses, and professionals, that transformation can't scale. And then we have an operational issue that we talked about earlier. So we're already very dependent, especially in the rural areas, for expensive contract labor. So this doesn't necessarily help that. So that's an area where we can reduce costs and hopefully operationally provide a focus where it's not as innovative, but it actually improves your sustainability. I think that's the key. And not get caught up too much in the buzz of AI efficiencies there, because that doesn't necessarily scale as well as some of these other investments that you could make in the community that I think are very smart, if not at least less glamorous from that standpoint.
Sure. And I wonder how many people really realize those caps and those limitations and what you can and can't do. So, the 5-year funding window is a major piece of this conversation. They're obviously not going to give you this funding all in one check, so to speak. Temporary funding can create opportunity, but it can also create risk if organizations build programs they cannot support later. It's kind of like, hey, I'm buying this brand new car and I can't afford the insurance for it. All right. So, how should rural providers think about that from the beginning?
Well, I like your analogy there. It is not necessarily putting a down payment on a Lexus. Let's put it that way. It's not that scary. However, healthcare has had an enormously long history of providing temporary pilot funding, creating success stories that unfortunately collapse once that money disappears. So again, you see this from a grant funding standpoint, where you hire behavioral health staff, care coordinators, and administrators, and then everything appears successful during that window. But then once the funding goes, you don't have other ways to support it operationally. And what now you're seeing is that if that grant expires after 5 years, no guarantee of moving forward. After that, and depending on how you feel about the gridlock in Congress and everything else, but the eternity is 5 years. What does that put you into a place of? Do you suddenly have to be forced into layoffs from those people, service reductions, or still talking about what we talked about earlier? Are you closing one department to feed into this transformation program because you know it's the right thing to do? But at the end of the day, it's kind of a wash on what you're providing for your community, which is what our whole goal is. So I guess every organization, no matter where you're at in this process, application, you've been assigned fund, is relationship. What happens year 6? What happens? We build this and everything goes underwater. We don't have any other funding source from the federal government or a state government, I should say. And if that answer is unclear, it should be a big red flag for you to consider how you're actually moving forward with this. So I think there's a lot of concerns on that end, and it remains to see what happens to the political landscape in 5 years, which I know, Stuart, we have a lot of money riding on that gamble that I don't think anybody can answer to.
Right, exactly. And a lot could change in 5 years and a lot that cannot change in 5 years, because, you and I both have been in this industry for a long time and it just seems to be the same problems resonate year after year after year after year. So there's a lot of ways that has not changed, but we also know that technology has changed as well. We don't know where AI is going to be because I've never seen anything accelerate faster than AI has accelerated, during my time from a technology perspective. But still, payers are going to be payers. Regulations are going to change, and regulations will change, for the better, sometimes create more complications. Just don't want this to be one of those complications. It can end up being a stumbling block for some people, but it can be taking a smart approach, like you've already kind of outlined, is key in understanding these realizations. But, I want to bring revenue cycle into the conversation because rural health sustainability is not only about clinical access, it's also about whether the organization can get paid accurately, efficiently, and consistently for the care it provides. That's been the mission for everyone in revenue cycle management for, it seems like, forever. Right, and we're still trying to achieve that. So where do you see revenue cycle fitting into this rural health transformation conversation?
Yeah, and again, talking about this, but one of my old statement I used to hate before I learned a lot from healthcare is without margin, there's no mission. And at the end of the day, if you can't feed your teams, you can't move forward and actually know how your community. And that's the difficult conversation to have. And I would tell you, revenue cycle may become one of those very, very important survival tools of rural healthcare and things that they actually can control and that are not funded. So as you mentioned, reimbursement's been tight. This has not been a new trend. This is something we kind of see in the writings on the wall. We can Bart talked a little about CMS kind of pushing that direction to value-based care being a little more practical. So every preventable bowel loss becomes very dangerous in the sense of like needing to keep on to the dollars you are earned. So many rural providers are already struggling with denials and prior auth. I think they're up 70, 80% over the last 2 or 3 years, which is just an insane amount from just a time suck that provides to your current teams and really delays reimbursement, which at the end of the day is what we're going for. So we can't afford leakage. I would tell you that CFO would tell you that reducing denial by 10 to 15% could stabilize your organization faster than launching a whole new service line or something transformation. And again, these are not like glamorous things. You're like, hey, go check out your CBM, go check out your strategic pricing. What are you doing in these areas? These are not the fun things you talk about in healthcare where you're providing like bedside care and how do you create innovation with a new great procedure or service you can provide. These are things that will become more important because as that belt tightens, you have to make sure you're receiving the revenue you earn. That's the whole thing insurance companies won't tell you is you did the work, you work the plan, you need to know how to get paid for exactly what you're doing right and doing it every time. And Transformation without financial education is just not sustainable.
Right. Right. Exactly. So with that in mind, what should rural healthcare leaders be doing right now? Even if they don't yet know exactly how their state will distribute the money, what conversations should they be having internally?
Sure, I used to talk a lot about this, and this is something very difficult. And you can say strategic planning is great, 3 to 5 year plan, but truly looking at this as purely a funding opportunity and view it as a long-term survival strategy. What does this look like? Is I think, as I mentioned earlier, CMS is kind of signaling the direction they're going to go, and that's not probably going to change even with different administrations involved. So the organizations that move fastest will likely understand their service line profitability. They'll have the data, getting access to how you're doing, where you're successful, how you're being successful, and figuring out how to essentially create more efficiencies or duplicate those efforts is going to be hugely important. And identifying your workforce vulnerabilities. If you have an EMS program in town, in colleges offer that, it's an associate nursing degree, things like that will help you forecast maybe some of the problems you can alleviate in the future versus trying to kind of wing this as trying to chase the dollars that are out there. So you might already be building regional partnerships and these collaborations and just create more operational efficiency plans. And I know everybody loves sitting in a good 4 hour strategy meeting, but nailing down some of those tactics is going to be crucial to success. And I would tell you right now, if you're waiting for perfect clarity, that's already been behind us. That's gone.
Yeah.
We all know from healthcare leadership that perfect information is a fallacy and you kind of do it the best you can. And the best way to do that is plan ahead.
Yeah, exactly. Plan and just start, right? So, which kind of leads to my final question for you. And that is, for rural health hospitals, even clinics and health system leaders, listening to this and thinking, wow, that sounds important, but it's also overwhelming. Because like you said, who wants to sit through a 4 hour planning meeting? But these are the things that you have to do. So what is the practical first step? Where should they begin?
Stuart, I think this is one of the hardest questions. I attend a number of lectures and talks, and I've coached on this. Is people struggle? How do I get started? Scott, that seems boiling the ocean difficult. And I would tell you just focus on the fundamental. Start at your very basic. If you're a revenue cycle, look at cash flow. What are your risks and benefits? Map that out. If it's workforce stability, figure out what areas need and start putting those plans together about what does that look like. And even if it doesn't work out, like I think we all get a little bit downtrodden. Then we have this great idea, and then you find out like it's just not realistic. We can't make this work. That's hard. That's okay. That's part of the innovation strategy of some of this transformation fund. But again, looking at your service line sustainability and your efficiencies, what you have, where you can improve will be very key to start. Just start looking at the numbers and work back and start talking to the people about what that actually means. And I think those are two things that often get lost in translations when we talk about strategic planning. Let the numbers tell you where to look, let the people tell you how to fix it. That's the way I would go about this. And because of this environment, this is not going to be a rescue package as we've already talked. And it's really just starting to talk about where you see yourself in the next 5 to 10 years. I feel like I'm giving an inherited question to you, Stuart, but truly start thinking about what that means to you and what that would mean for your community and start talking to people when it means the most to them. So I would say it's also possible, and the model itself is difficult at the same time. There's a lot of good people. I think there's going to be some good things.
Awesome. Yeah. Great insights. Again, that's it for my questions. So again, if you have a question for Scott, please enter it into the Q&A section. Also, if there's any comments that you'd like to make for any insights you may have, please enter those as well. So we do have one question that's come in, Scott, and that is, how can smaller rural providers compete for funding if they don't have dedicated grant writing policy or strategy teams? And you may have alluded to this earlier, I think, in a question, but maybe this is more the key word here to me sticks out is compete for funding.
I would challenge this that it's not necessarily the competition. I think there's going to be this limited funding will go. It's going to be who kind of puts in the work. I think that's where we're going to come out to. you don't have the grant resources, I would tell you, looking at coming from my rural background and having been in this position, is find somebody that might have a little bit of passion for this or even a little bit of interest. And a lot of this is just digging into the policy and doing some very fun reading. I know it's an old school tactic in the world of AI, but reading through and figuring out where this can apply and then providing the bandwidth to a team member that has that interest to start focusing on how that works, start listening to what ideas that kind of support that. That's where I go. First step. Second step is look into your state resources. I know all the hospital associations are looking at how they support, especially the rural areas. They might be able to provide some things. It kind of varies by state, as we talk about. I'd also look to your academic medical facility. That's usually where the heart. I know the state of Kansas has done a great job of this, partnering with University of Kansas, providing great writing support for some of the rural, especially in the Western Plains region. So looking for other areas that maybe there's some support, or if you have a network or a larger health system, that's another area I'd look, because I know they would be invested in how to help you. There's a number of areas, but at the end of the day, Stuart, I would tell you start looking at what your team, how do you provide bandwidth to that team to do some of this work if this is truly important to you. And that's the whole key to the game. And finding ways to support your team members and find out and trusting their answer when they come back.
Perfect. Well, and I'm looking through, I don't see any more questions, Scott. Again, I want to thank you for joining. I know you're a very busy guy, but thanks for taking the time to share your insights on this. I know you've brought a lot of clarity, hopefully to some folks out there who are concerned about this.
Yeah. Thanks, Stuart. It was a pleasure. And like I said, good luck to everybody working on this. This is not easy, but I know we have a lot of smart people doing some hard work.
That's right. And I want to thank everyone else for joining us today as well, and taking your time to be with us. And then visit us at Infinx.com. And we have a lot of articles, case studies, and also solution insights, basically all things RCM.
Thanks for joining us. Subscribe to get notified when our next episode is online. For more information for how we can help you increase reimbursements at your company, check out our website at Infinx.com. That's Infinx.com.